What is stalking? Stalking is a public health problem that affects millions of people in the United States. Stalking involves a perpetrator's use of a pattern of harassing or threatening tactics that are both unwanted and cause fear or safety concerns in a victim. Stalking tactics can include 1. Unwanted following and watching of the victim. 2. Unwanted approaching or showing up in places such as the victim's home, workplace, or school. 3. Unwanted use of global positioning system technology to monitor or track the victim's location. 4. Leaving strange or potentially threatening items for the victim to find. 5. Sneaking into the victim's home or car and doing things to scare the victim or let the victim know the perpetrator had been there. 6. Use of technology, for example, hidden cameras, recorders, computer software to spy on the victim from a distance. 7. Unwanted phone calls, including hang-ups and voice messages. 8. Unwanted texts, emails, social media, or photos messages. 9. Unwanted cards, letters, flowers, or presents. Using technology to socialize and communicate has its conveniences, but it can also make it easier to find people to harass others in ways that might be frightening and threatening. Okay, so how big is the problem? The National Intimate Partner and Sexual Violence Survey reports that about 1 in 3 women and 1 in 6 men have been stalked at some point in their lives. While most women and men first experience being stalked as adults, approximately 24% of female victims and 19% of male victims reported being stalked as minors. Nearly 58% of female victims and 49% of male victims experienced stalking before the age of 25. Okay, so what are the consequences? Women and men who were stalked felt fearful, threatened, or concerned for their safety or the safety of others as a result of the perpetrator's behavior. About 69% of female and 80% of male victims experienced threats of physical harm during their lifetime. Research has shown a relationship between stalking, victimization, and complaints of pain and poor current health status, injury, and chronic disease. Studies have also shown that stalking can lead to psychological distress such as depression and post-traumatic stress disorder. Okay, how can we stop stalking before it starts? It is important for everyone to work together to end stalking. The recent sexual violence survey found and highlighted the importance of early prevention and support efforts, which can include empowering everyone to understand, recognize, and address stalking, mobilizing men and boys as allies in prevention efforts, creating and supporting safe environments within relationships, schools, and communities through programs and policies that reduce risk and promote healthy relationships. And for more information about intimate partner violence, sexual violence, and stalking among men, you can visit the Intimate Partner Violence, Sexual Violence, and Stalking Among Men article. There's a link in the article associated with this podcast. Okay, if you need help or know someone who does, you can contact your local service provider or national hotline. You can call 1-855-484-2846 or the National Domestic Violence Hotline at 1-800-799-7233 or the Sexual Assault Hotline 1-800-656-4673. Also, a lot of great links in the article associated with this podcast. Citation: National Center for Injury Prevention and Control, Division of Violence Prevention. Thank you for listening.